Welcome to the Truth About Utilization Management, what every nurse needs to know, brought to you by Healthcare Nurses Network and Nurses Link Up, where nurses connect, communicate, and collaborate to drive better patient outcomes. Whether you're at the bedside or in the boardroom, you play a critical role in shaping patient care. This podcast is dedicated to empowering nurses with the knowledge, strategies, and tools to integrate utilization management principles into daily practice, without adding more to your workload. Utilization management. It's a term that can bring confusion, frustration, and feel like a barrier between nurses and optimal patient care. But what is the reality? How can nurses navigate this complex system effectively and uncover the truth behind the processes? Join experienced ICU nurse James Carter, BSN, RN, and nurse manager Emily Ramirez, MSN, RN, as they explore the facts, drawing from a comprehensive 10-part series of articles written by Dr. Nicolas Abella. James and Emily delve into each article, translating expert insights into practical skills for today's nurse. This episode kicks off the series, focusing on Dr. Abella's crucial first article. They'll tackle everything from the real difference between utilization management and utilization review, to denial-proofing your documentation, mastering collaboration, leveraging technology, understanding the metrics that matter, and preparing for the future. Get ready for clear answers, actionable strategies, and the empowerment that comes from truly understanding utilization management. Presented by Healthcare Nurses Network and Nurses Link Up, here are your hosts, James Carter and Emily Ramirez, with the truth about utilization management, what every nurse needs to know.
Welcome back to the Healthcare Nurses Network podcast. You know, we're all about helping you thrive in your nursing careers, and today we're going to tackle something that...
I make you groan a little bit.
Oh, yeah.
But trust me.
Oh, I'm trusting you already.
When you get it can actually re-energize that passion we all have for nursing.
Okay, I'm ready.
We're talking about utilization management, or UM, as we like to call it in the biz.
Okay, M. Now, I gotta say, when I hear those two letters together, I instantly think...
Utilization review, right.
Yes.
Yeah, it's more reactive cousin.
Yeah, and that can feel like a battle sometimes, right?
It can.
Like you're fighting for your patients.
Absolutely.
But what if I told you, and I think you're going to tell me this,
I am,
that when we approach it proactively, could actually be like our secret weapon to becoming an even stronger advocate for patients.
It absolutely can be. That's what we're going to explore today. We're going to unpack these terms, utilization review and utilization management, and look at how we can shift from that reactive mindset to a proactive one, and how that can actually empower you at the bedside.
I am so intrigued. But let's just start with the very basics. What is the core difference between utilization review, that leaves us feeling frustrated sometimes, and utilization management?
You know, you hit the nail on the head when you said frustrated. Utilization review is often a source of that frustration because it happens after the fact. It's someone looking back at the chart and saying, was all this care really necessary? Did it meet the criteria? It's all about justifying care that's already been given.
So it's really about making sure the hospital gets reimbursed, but it doesn't always feel like it's what's best for the patient.
You're right. That's often the perception, and studies show that this reactive approach can lead to a lot of burnout and feeling powerless, like Shanmugam in 2024, Struthers and his colleagues in 2024.
Yes, I know those studies.
They show just how much it impacts us.
That powerless feeling is the worst. You know, you're there to help your patients, and it's like
your hands are tied.
Exactly. So how does utilization management differ?
Utilization management flips the script. We're going from reactive to proactive. Imagine a world where you're not constantly playing defense, You're actively shaping that patient's care plan from the very beginning to make sure that they're getting the right care at the right time in the right setting.
Okay, that sounds amazing.
It is.
In theory. But can you give me like a really concrete example?
Absolutely. Let's say you've got a patient admitted for pneumonia. They're recovering well, but you notice that they have a kind of complex social situation. Maybe they live alone, maybe they don't have a strong support system. So with a proactive mindset, you're not waiting until discharge day to kind of hope for the best.
Right.
You're getting ahead of it. You're communicating this information early on to the case manager. You're really advocating for that patient.
So I'm flagging those discharge barriers before they even become a problem.
Exactly. You're not just advocating for your patient, though, you're also contributing to a smoother discharge process, which ultimately benefits everyone. And the research backs this up. Hume and colleagues in 2023 found that this kind of proactive care management really leads to better outcomes for patients.
Research is always good.
Always.
Okay, I'm starting to see how this little shift can make a big difference. But, I know some of our listeners out there are thinking, I don't have time for this. I know I am.
It's a common concern.
Yeah, we're already stretched so thin. We have limited time. We have limited resources.
I hear you. We're going to dive a little deeper into some of those concerns later and talk about strategies for overcoming them. But first, I want to emphasize we have so many resources available at healthcarenurses.net that can help you get started with implementing these principles.
Yes. Head over to healthcarenurses.net. We've got articles and quizzes, even a really cool comparison chart that'll help you see the difference between UR and I love that chart. It's so helpful. Now, I'm curious, how does this actually play out in different nursing roles? I mean, we've been talking kind of generally, but
Yeah, good point.
how does it look for a bedside nurse versus, someone in a management position?
That's a great question. Proactive isn't just for the bedside nurse. Nurses at all levels, from charge nurses to nurse managers, even CNOs, can use these principles to make a difference. So let's start with that bedside nurse. One key area where can really make a difference is in understanding and applying medical necessity.
Medical necessity. That's another one of those terms that we hear all the time. But what does it actually mean, like on the ground?
Yeah, it really boils down to this medical necessity means that the care that's being provided is appropriate, necessary, and backed by evidence-based guidelines. We're not just checking boxes on a form, we're really understanding the why behind the criteria.
So it's about really getting why a test is ordered or why a treatment is necessary for that patient, more than just knowing it's required.
Yes. Connecting those dots and seeing the bigger picture. So let's say you have a patient scheduled for surgery and there's a pre-op test ordered. A nurse with a strong grasp of medical necessity doesn't just see that as a routine task. They're really thinking about, why is this test crucial for this patient? What information does it give us? How does it help us make better decisions about their care?
So they're really thinking critically about it and not just blindly following a checklist.
Exactly. And that deeper understanding can really help you advocate for your patient more effectively. Let's say a doctor orders a treatment or a test that, based on your assessment of the patient, doesn't seem medically necessary.
Okay, that can be a tough conversation to have.
It can, but don't be afraid to speak up. Approach the doctor respectfully and say, hey, I'm a little concerned about this. Here's what I'm seeing with the patient. Really highlight the specific things that are making you question the necessity of that order. And frame it as a collaborative discussion. We're all here to get the best possible outcome for this patient.
That's a good point, framing it that way, not challenging their authority, just advocating for the patient using your knowledge.
Yes. So moving beyond the bedside, a charge nurse can use proactive to mentor their team. They can hold huddles, discuss challenging cases, share documentation tips, really foster that culture of proactive patient advocacy.
I love that, making it a team effort.
Absolutely. And then at the management level, a nurse manager can analyze data, right? Look for trends or areas for improvement. Let's say they notice a lot of denials related to a particular diagnosis. They can implement targeted education for the staff, really focus on documentation for that diagnosis.
So they're using data to improve things and empower their staff.
Exactly. And then even at the executive level, a CNO can champion that hospital-wide shift towards proactive implement policies that support nurses, make sure there's training available, really create a culture that values patient-centered care.
So it really does touch every level of nursing.
It does. And speaking of empowerment, let's talk about documentation. I know. It's not the most glamorous part of nursing.
Oh, the dreaded documentation.
But it can be such a powerful tool when it comes to
I know it's important, but it feels like a mountain of paperwork sometimes.
Yeah, I hear you. But think of your documentation as telling a story that really justifies the medical necessity of the care you're giving. So be clear, be concise, focus on the why. Why does this patient need to be in the hospital? Why do they need this level of care? Why is this treatment necessary?
So then instead of charting like patient ambulated in the hallway, I would say something more like patient ambulated 50 feet in the hallway with a steady gait, requiring minimal assistance for balance, tolerated well without shortness of breath or chest pain. Like really paint that picture.
Perfect example. That level of detail really shows the patient's current status and supports the need for that continued skilled nursing care.
Got it. So I'm thinking about my audience, not just the next nurse, but also whoever's reviewing the chart for medical necessity.
Exactly. And that applies to other aspects of documentation too. Like when you're documenting a patient's home situation, don't just write lives alone. Provide some details. Do they have stairs to climb? Do they have someone to help with medications?
I'm giving that full picture so that everyone's on the same page.
Exactly. And that brings us to another really critical component of proactive communication. It's not enough to just document, well, we also need to communicate effectively with the rest of the care team.
That's a struggle sometimes.
It can be.
It's like playing phone tag with the case manager or waiting for a doctor to call back.
You're right. Proactive communication can help with that. Reach out to those case managers early and often. Don't wait until there's a problem. Share your observations, ask questions, and really work together to create a care plan that addresses everyone's needs.
So instead of waiting for the case manager to come to me, I should loop them in from the start. Like say during shift report, I mentioned a patient's complex social situation that might affect discharge planning.
Exactly. That early heads up lets the case manager get ahead of those potential issues.
Working smarter, not harder.
That's it. And don't forget, communication with physicians too. That open and respectful communication with doctors is essential. If you have concerns about an order or a treatment plan, don't hesitate to voice those.
It can be intimidating to do that, especially for a new nurse. But you're right. We need to be comfortable sharing our concerns and advocating for our patients.
And that confidence comes with knowledge and experience. The more you understand about medical necessity, the more comfortable you'll be advocating for your patients. And remember, you're not alone. You've got your colleagues, your nurse leaders, all those resources to support you.
This is so empowering. It's like we're taking back our role as patient advocates and really making a difference. But I think there are some lingering concerns out there about especially about the time constraints and how this all affects the quality of care.
You're right, those are important concerns. And we're going to tackle those head on in our next segment. We'll talk about how to overcome those roadblocks, find those pockets of time, and really make part of your daily practice.
So welcome back to the Healthcare Nurses Network podcast. We've been deep diving into utilization management and how we can really use it to be better advocates for our patients. But there are some concerns out there, concerns about time, concerns about resources, and really how all of this affects the quality of the care that we're giving.
Absolutely, and those are valid concerns. We're going to address them head on and give you some practical strategies that you can use right away. Let's start with that big one. Time. I know so many of you are thinking, I am already running ragged. How am I possibly going to add one more thing to my plate? But here's the thing. Proactive, while it does take a little bit of effort up front, can actually save you time in the long run.
Okay, I'm listening because my to-do list is already a mile long. So how does investing a little bit of time up front actually save me time later?
Think about all the time you currently spend dealing with denials, tracking down missing information, or trying to arrange last-minute discharges. Proactive can help you avoid all those time-consuming headaches because everything's in order from the very beginning.
So it's all about preventing those problems instead of just reacting to them when they pop up.
You got it. And the beauty of it is that you can integrate these principles into your existing workflow. For example, during that initial patient assessment, take a few extra minutes to really ask about their home situation, their support system, any potential obstacles to discharge.
That's a good point. We're already gathering that information anyway, so why not use it strategically to get ahead of those issues?
Exactly. And remember, you don't have to do this all by yourself. Lean on your colleagues. If you notice a trend of delays or denials related to a specific issue, bring it up at your next staff meeting. Talk to your charge nurse, talk to your nurse manager, share your observations, and work together to brainstorm some solutions.
Yes. Teamwork makes the dream work. So we're making this a collaborative thing. It's not just another task on our to-do list.
Right, and that collaborative spirit can extend to other members of the care team too. Remember all that stuff we talked about with communication. By looping in those case managers early and often, you're not just advocating for your patient, you're also building a collaborative relationship that can really streamline the whole process.
Yeah, and a smoother process means less stress for everyone, especially for the patient. And speaking of the patient, I want to circle back to that other big concern, quality of care. Some nurses worry that is all about cutting costs, that patients might end up receiving less care than they need.
That's a valid concern. But it's important to remember that done well is not about denying care. It's about making sure that the care is appropriate, it's efficient, and it's in line with the patient's needs and evidence-based guidelines. And when we really focus on giving the right care at the right time, we can actually improve the quality of care and patient outcomes.
Can you give me an example, like a real-world example of how that might work?
Sure. Let's say you have a patient who would benefit from a specific therapy or piece of equipment, to really help their recovery, but you're also aware of, budgets and things like that. So instead of just throwing your hands up and saying, well, there's nothing we can do,
Huh.
you put on your proactive hat and you start exploring options.
So I would talk to the case manager, explain why this therapy or equipment is so important, and we would brainstorm together and try to find a solution.
Exactly. You're using your expertise, advocating for your patient, and working within the system to find a solution that really benefits everyone. You're also helping with better resource allocation because you're making sure those resources are being used where they're most needed.
I love that. It's like we're flipping the script on and using it as a tool to advocate for our patients instead of it being a barrier to good care.
That's what we want. Remember, is not about saying no to care. It's about finding creative ways to say yes to the right care at the right time.
This has been so helpful. I'm feeling a lot more optimistic about and all the good it can do for our patients. I think the biggest thing for nurses is just knowing where to start. It feels like such a huge, overwhelming topic.
That's why we're so excited about all the resources we have at healthcarenurses.net. We have articles and quizzes, even a really easy-to-use comparison chart that helps you really see the difference between UR and UM. And of course, we're always here to answer questions and offer support.
We are always here for you. So to wrap things up, what's the one key takeaway you want our listeners to remember about utilization management?
I want nurses to see that is not the enemy. It's a really powerful tool that, when we use it proactively, can help us be even stronger advocates for our patients. It's about being informed, being assertive, and working together as a team to make sure our patients get the best possible care.
That's a great takeaway. And as we've seen, this is something that nurses at all levels can use and really champion. So to all our amazing listeners out there, I have a challenge for you. What's one small change you can make this week to be more proactive when it comes to Maybe it's asking an extra question during those patient assessments. Maybe it's having a quick conversation with your case manager. Or maybe it's just taking some time to really look at those medical necessity criteria. Every little step makes a difference.
We believe in you, and we're here to support you.
Thank you so much for joining us on a Healthcare Nurses Network podcast. We'll be back next week with another deep dive into a topic that we know you're going to love. Until then, be sure to head over to healthcarenurses.net for more resources and support. Thanks for listening to the Healthcare Nurses Network podcast.